The Duke Endowment is truly distinctive in the manner in which our benefactor, Mr. James B. Duke, in 1924, in the trust indenture, described quite specifically the philanthropy that he wished to bestow forever on his native region of the two Carolinas, that is health care and child care and higher education and the Rural Methodist Church in North Carolina. He also, and this is unique, I'm sure, expressed his mandate that we follow those wishes by requiring the trust indenture in which they are described to be read to the entire board, word for word, at least once each year. It takes 42 minutes to do that, and we have read that indenture has been read every year for 85 years, with the result that there is a dedication and commitment in the endowment that is exhilarating for all of us.
The endowment in its 85 years has dealt with good years and with trying years. And through those trying years, I think we all work harder and work in some respects even smarter because you do have limited resources. And it places an emphasis on trying to work in ways that will extend dollars. I think Mr. Duke would be proud of that and would be pleased and applaud those efforts. He was a man of change. As his world changed, as economic conditions around him changed and presented different opportunities, he moved to take advantage of those. The Duke Endowment will be trying to do the exact same thing. Duke Endowment has made a point to work with other organizations, most notably other foundations that had similar funding interests to those that we're able to support. That has increased this year pleasantly because other foundations, as we, have more limited resources. And we know that if we work together, if we plan together and work on those highest return projects, that we're able to extend the limited dollars that we all have to reach more and broader organizations in both states.
A great example of that is our Nurse Family Partnership Program, in which we do collaborate with other foundations and with state agencies and with churches and other nonprofits in a program that serves the needs of low-income first-time mothers and their children in a very special way.
Another example of this collaboration that has brought together a number of funders in both states, separately in North Carolina and in South Carolina, has been around the work to meet the needs of the uninsured poor. In North Carolina, it's resulted in the Care Share Health Alliance, South Carolina in Access Health, South Carolina. Both of these organizations work to bring together organizations and individuals, physicians, that provide care to the uninsured, but to do it in a more coordinated and effective manner. To accomplish this work, it has meant that the foundations or the organizations that have funded this work have needed to work together at a deeper and more substantive level than ever in past years.
I'm sure Mr. Duke would be very pleased and very proud of what has been accomplished. We have, in serving as he wished the needs, particularly of those who are least able to care for themselves. The Nurse Family Partnership Program is a great example of that. And 2008 was really a milestone year. We went over $204 million in grants, which I think would amaze and please Mr. Duke greatly.
2008 draws together yet another year of the life of the Duke Endowment and the work that we're able to do in the Carolinas. It also, though, reminds us the Duke Endowment over its many years of operation has faced good years and has faced challenging years, to which 2008 has certainly been one. That, though, I think is emblematic of what Mr. Duke lived and did with his professional career. He was a man that dealt with good times and bad, and often altered what his work was when opportunities and financial circumstances presented different areas for him to concentrate. The Duke Endowment will try to do the same through 2009.